3.8 of the people in Uganda are living with depression. Now, note this, that 3.8 is actually the population or the fraction of people that are seeking help. Now, the other percentage are actually living with depression, but they do not know and they are not even able to seek help. And that is why we are actually having this conversation this morning. And this morning, we're going to be looking at how to deal with depression, especially during this festive season. Yes, Christmas is drawing near. We are getting into the New Year's. We've had people saying probably they should postpone Christmas, which I do not think is a wise idea to do. However, for a number of people over the world and in Uganda, they do not see a reason to celebrate. Why? Because they've been through pain, they've been through heartache, they've been through trauma because of COVID-19. People have lost their loved ones, people have lost their livelihoods, and that is why we thought this morning it is very important to give a word of encouragement, to give a word of hope to the people that are actually going through this sort of depression. However, we are going to zero it down and we're going to be looking at clinical depression. And let me read out what it basically means. And it means this is a serious mood disorder involving one or more episodes of intense psychological depression or loss of interest or pleasure that lasts 2 or more weeks and is accompanied by fatigue, poor concentration, sleep disturbances, weight gain, loss of feelings, worthlessness or guilt, and sometimes may even escalate into being suicidal attempts. Now, I am someone who is passionate when it comes to mental health. I'm always advocating that mental health is important. It is important that you be kind. It is important that you speak up when you're going through something, especially mentally related. This morning, joining me on the panel is Dr. Hani Kajubi, who is a psychosocial therapist. I feel like she has the most amazing name. Dr. Hani Kajubi, good morning, and thank you for joining us today on Sunrise at Sea.
Good morning, Shivan. You look amazing this morning.
Thank you so much.
Thank
you for allowing
me
to be here this morning.
I'm humbled.
Now, we're going to be talking about clinical depression and basically talking about how we can actually celebrate the festivities even amid this COVID-19, even the fact that people are going through so much. And this morning we're going to be talking about clinical depression. First, before we dive into the conversation, because someone might wonder, okay, I've understood what clinical depression is. I might not even know that I am going through clinical depression. So what are some of the signs and symptoms?
Thank you, Shivan. So as you've said it, depression is really a mood disorder that is characterized by a long period of low mood, sadness. Really, it should be over 2 weeks and above. And also, you can't have only one symptom and say I'm depressed. For example, if you've been sad, going through maybe grief, that's expected, but you must have drastic mood changes, irritability. Some people experience a sudden loss of sleep or oversleeping, loss of appetite. A very common one is interest in life itself, in general activities you've been doing. Some people, it could be sex, it could be sports. So it's a couple of all those symptoms. They must be there. But the clear way of knowing that you're depressed, once you feel any 2 or 3 of these things or observe your loved one having drastic changes in the way they've been living, please recommend them to go and see a psychiatrist, a medical professional who will diagnose them according to what is happening and then say, yes, you're clinically depressed. So you can't just wake up and say, I'm depressed. But if you feel things are changing around you, you feel hopeless, you feel sad on end and nothing is making sense to you, or you feel you don't have the urge to live anymore, then you must see a professional immediately.
But doctor, here is the thing. Many times, especially in the African culture, depression is a topic that not many welcome, even in our homes. I mean, there are times when we go through depression. I have been through depression, but for many, I remember there's a time I received a comment and someone told me, but those are diseases for the whites. For us, we used not to have anything. We are the poor of the poorest and we are never depressed. You kids of nowadays have everything you want, but you're still going through depression. So don't those comments also play a hand in even triggering and making someone more sick?
Yes, most definitely. Shivan, we must understand that, for example, even in Uganda, depression is mostly diagnosed in the youth or people between the age of 18 to 30. That doesn't mean that children don't have depression or teens. However, this is the age whereby people are trying to achieve in life, and there's so much pressure out there. And so, for example, Shivan, you've been very sporty, liking life, and then with the advent of social media, your peers have got jobs, they are driving Porsche cars, so you're going to feel a certain way, and that way might go beyond just being sad, but feelings of low self-esteem, guilt, you know, criticizing yourself, what's wrong with me? And like you said, in African cultures or most families, you come and say, hey, I think I'm depressed, you know? And the first thing for someone to say, oh, what do you mean you're depressed?
What are you depressed
so
about?
There's a stigma around the word depression, but it's just a normal term to define that you're not feeling well mentally. And mental health is wide. It can be out the way we live, our social life, it can mean psychological, or changes in the way we think, act, or even relate with others. So I would advise that if someone came to you and opened up and said, hey, I've been feeling unwell of late, or I'm feeling a certain way, or I think I'm not living up to my expectations, give them an ear. If you can't, then refer them. Please refer them to any medical professional out there. Shivan, you can walk into, I know people would say, how do I find the right medical professional? Right. But if you walked into any clinic or any medical establishment and explained how you feel, then that professional should be able to send you or refer you to a mental health practitioner, because we know them and we know where they are. So there is help all over. If you can't move into an established clinic, you can also go on Google. You can Google mental health services in Uganda. There are numbers there, there are websites there. You can call up someone, and I'm sure someone will pick up and direct you to the right person to diagnose you and help you.
Okay. Now, Doctor, looking at the aspect of festivities, we're in a time where we're celebrating Christmas, we're in a time where we're heading to a new year. However, for many people, and I may speak for the majority, they do not see a reason to celebrate. So when it comes to clinical depression, do the festivities make it worse or better? Or does that mean anxiety levels are going to go up? Like, what does that really mean?
So we cannot generalize and say that festivities or holiday seasons would worsen or make things better. However, it is known that people who have been suffering from depression or anxiety will have heightened stress levels during those times. A recent report from WHO has reported that over 88% of people have reported to have what we call holiday depression or seasonal depression. So what happens is Christmas holidays like these are supposed to be beautiful, you know, merrymaking, but that's not true for everyone, unfortunately. Now, if I look at the last 2 years we've just had with this COVID-19, it's definitely going to, you know, impact most people. There's been a lot of loneliness, there's been a lot of death world over, even in Uganda. I think our worst hit time with COVID was this year around June. Lots of people passed on. So families that are used to gathering together and having their loved ones together, they are going to miss those people, and they could experience prolonged sadness or even feel like, why are we celebrating? There's no meaning to life. Then also, so it's going to be different. There are some people who are going to say, let's be grateful. Actually, as a mental health advocate, I would say be grateful that we are here. Be grateful that we are still living. Be grateful that there is hope, because life is about having hope. Then let's celebrate that. Let's come together. Even celebrate the memories of those that have gone, that have departed. So, because if we say it's been all gloom, let's just sit back, then it's going to actually create more anxiety, more sadness, loneliness, and then, of course, after 3 weeks, a month, it could become depression. But also we have to be cognizant of the fact that maybe people are generally anxious, there's no money, people have been out of work for 2 years,
Yes.
teachers, the whole economy was shut down, restaurants, everything,
So
you know.
everyone literally is going through something.
Artists, you know, so people are thinking, what are we going to do now?
Yeah.
So naturally, there is a general anxiety around Christmas. People want money to buy gifts, to throw fancy parties, but this time it's worse. However, we can still go home, have a simple meal, you know, pray, be grateful. We don't have to do it as we've always done in the past, but definitely we can't say let's postpone. I think that's going beyond. Okay.
Yes.
So,
now, how about looking at, I mean, for someone who is going through this kind of depression, and like you said, they don't feel a reason to celebrate, or maybe even advising them that they might not do it the way they always do it, they could just have a smaller celebration. Now, before they even seek the professional help, because for mental health, I mean, not very many people can afford to access mental health services.
True.
So what would you tell someone this morning, or what sort of personal treatment, if I am going through that kind of phase right now in my life, what would you tell me so that I work on myself?
So, first of all, you can be experiencing beautifully sadness, you know, prolonged sadness, or you're feeling like things haven't gone right, you know. Now, if you haven't sought help before, then you cannot classify yourself as being clinically depressed, because you must see a professional to be given that diagnosis. And for those who seek medical help, then the professional, the psychiatrist, the psychologist will make a plan for you, a treatment plan. Some people get better on medications, others use therapy, just talk therapy, which is mostly given by psychosocial therapists like myself, and others use a combination of both. Now, for someone like Shivan, who has not yet seen or sought medical help, and you're seated home right now and you're saying, there's no hope. What am I celebrating? You know, I have no money. I have no job come January. I don't know what life has in store for me. If you feel like that, first is to acknowledge that you're feeling a certain way. And then two, seek someone who is a trusted friend or family. If not family, a religious counsel, someone you can open up to, because talking to someone helps. It goes a long way to talk about your feelings. And also, if you have some energy, do some exercise. Exercise goes,
Very
even when we are prescribing, you know, in talk therapy, away from the drugs, when you do some exercise, 30 minutes of aerobics, walking around your house, running a bit, skipping a rope, gives you feel-good hormones, okay? So that will elevate your feelings. Yes, you don't have money, you don't know what tomorrow is going to bring, but your mental health is getting better, okay? Keep off social media if you must.
That is a hard one.
Keep off social media, because with social media, especially the youth, I know, even up to, I guess, 50-year-olds.
Even the adults.
Yes, even the adults. So we compare ourselves a lot with the haves and have-nots. And so when you're in that state and you keep on social media, you're going to see people going for vacations, you're going to see your peers celebrating new cars, gifts, and these things. And definitely that's going to play a big role with your mental state. So if you are not in a position where you can celebrate something, please do yourself a favor and minimize your social media, you know, presence, Facebook and these things. Then lastly, do not remain isolated. Try as much as possible to interact with people. Either have Zoom meetings, WhatsApp group meetings. Out there's someone that cares about you, okay? Check on someone and, you know, go visit a friend. Tell a friend, hey, things are hard, things have been hard, but can we, you know, have a cup of tea? Or so try to be out. Don't be in bed. Avoid being alone, avoid sleeping, avoid indulging in alcohol, because alcohol is a depressant. So most people use alcohol and drugs to think they are going to treat the feeling of being sad and lonely, but instead they make it worse, because alcohol use and drug use will just make your depression worse.
Even worse. I like the fact that you mentioned that if you're going through this sort of depression, you might want to keep off social media, because I realize the youth of today are always comparing themselves. You see, what you see on social media most times is actually not the truth. Someone will show you that they're having the time of their life, yet they're actually struggling with something, and you'll want to be like them, and you'll end up getting somehow depressed.
Don't we always want to put out the very best of us?
But
Everyone.
for most people, it's more of a social media life. What you see on the media, social media especially, is not actually what is taking place in the person's life. However,
very true.
According to statistics, women seem more prone to getting depression. However, I believe that is a reason as to why that is because not so many men are comfortable to come and talk about the fact that they are going through depression, because even African culture has made it seem that if you're a man, how can you depressed? How can you be depressed? How can you be feeling sad? You're supposed to be the provider. You're supposed to be the stronghold in the family. So if you're depressed and, for example, you're married, what is your wife supposed to do? So advise the men that are going through some sort of depression, because they are also people that have lost their loved ones. They are human beings. They have a right to feel the way they feel. They have emotions. So what would you tell a gentleman that is watching us this morning that is going through those feelings of unworthiness, those feelings of sadness, and how to overcome it?
Okay. Of course, you've said it, and the American Association of Psychologists has clearly shown that, yes, depression is more prevalent in women. For example, in Uganda alone, it's about 5.1% women suffering from depression, or who have been diagnosed, to 3.2 for men. Now, our brothers, our fathers, our husbands, out there, who are suffering or feeling a profound sense of dejection, a profound sense of loss. Most men who are breadwinners in our African homes have lost their work or had to accept lesser pay over the last couple of years. So they must be going through a certain feeling, which is not just sadness. It could be bordering to depression. And they are there sitting and, maybe being domestic violence champions, because they are easily irritable. Remember, they are angry, they have terrible mood swings. And so the first thing is to accept that it is okay not to be okay. For a man especially. For a man, it is okay not to be okay. It is okay to open your heart to someone, go out there, talk to someone, a friend. Males like sharing with their male friends, It does not feel masculine, but this is not a time to start wanting to be masculine. You're not made any less by coming and saying, things are hard. Everyone understands things have been hard, Yes. Things are hard. I need help here. What can I do? Yeah. So, in fact, you may be surprised. It starts with our mental health. Like I said, you have to have a good mental space for you to achieve more. You've heard where people say, I'm not in my right frame of mind. So if you're not in your right frame of mind, how are you going to make next year better? Yes. Next year, come Jan, the economy is going to open up, no more lockdowns, hopefully, please. And so people must come back to living, So I appeal to the gentlemen out there, please speak to someone, please use Google, find a Ugandan facility you can go to. You can go to Nakasero Hospital, has a very good psychiatric unit there. The medical hub Kololo, where I'm working, it also has a very good team of psychiatrists, psychologists. You can even reach out to any other medical center. If they cannot handle you professionally, they should be able to refer you. Okay, well, thank you so much. This conversation has been so amazing, and would want to have it on and on. And thank you for gracing us. Merry Christmas. I will be coming for some coffee. Merry Christmas, Shivan. Thank you for having me. I've enjoyed talking about mental health. I'm an advocate. I'm passionate about it. There is help. Maybe I need to say that if you're ill, there is help. There is help, and it's treatable. You just need to find the right people.
Okay, well, you heard it from the doctor herself, and I hope you are able to pick a thing or two. At the end of the day, if you're going through a phase in your life where you're feeling sad, where you're feeling low, it is very important that you seek medical attention, especially if it's trying to escalate into suicidal attempts. That is very important. But also, do not isolate yourself. Keep talking to someone. But also for the people out there, Banange, let's learn to be kind. Be kind. Do not stigmatize depression. Depression is real, and it's something that is actually happening in our society and in our homes. To the adults and to the parents, please be patient with your youth and teenagers. It's a phase that they're going through in their life. And that winds up the conversation that we had for you this morning. Good morning, and don't blink.